Hi, everyone. My name is Chris Palmer. I'm a psychiatrist at McLean Hospital and Harvard Medical School, and it's my pleasure to introduce you or to welcome all of you to today's webinar. In the past, we've talked about the mental health effects of the COVID-19 pandemic, and we've focused more on the effects in the population at large. And make no mistake, there are profound effects on people's mental health from the stress and the chaos of what we're all going through. But today we're going to focus on a particular population, and that is healthcare professionals. As we've been doing these webinars, we've been getting a lot of questions about what are we supposed to do, those of us on the front line, or what are we supposed to do for our colleagues on the front line? How can we support each other better? And so that's our focus today, is the mental health effects of this pandemic and the increased stress on the healthcare workers and frontline workers. Before we get started, I have a few announcements to make. So this webinar is being recorded, and the link for the video will be available within a few days. The recording will be shared via email and will be posted on the Harvard Medical School website, and continuing education are available. When today's webinar concludes, you can click on the evaluation link in the description below this video window to obtain continuing ed credits. We really want this webinar to be interactive for all of you. And we're gonna have a brief presentation at the beginning, but we're gonna leave ample time for questions and discussion on issues that are relevant to you. So if you've come to this webinar with a specific question in mind, or you're thinking about a colleague or yourself, and mental health effects of what's going on in the world, and you want more information, or you just want us to answer questions, please type them in to the chat box that you see on your screen, and we'll get through as many of those questions as we can. Again, if you come to the webinar with a specific question in mind, feel free to type it in right now, and we'll put as many of them in queue as we can. So now it's my pleasure to introduce our speaker for today's webinar, Dr. Brent Forrester. Dr. Forrester is the chief of the Division of Geriatric Psychiatry at McLean Hospital. He's the medical director for behavioral health integration in primary care. So basically mental health in primary care clinics at the Mass General Brigham. And he's an associate professor of psychiatry at Harvard Medical School. He's an expert in geriatric psychiatry, specializing in depression, bipolar disorder, and behavioral complications of Alzheimer's disease. He oversees large-scale efforts to improve the care of people with dementia and support their families. He also does research on a variety of other topics related to the mental health of older adults. He's currently the co-president of the American Association for Geriatric Psychiatry and a distinguished fellow of the American Psychiatric Association. And I'm going to turn the webinar over to Dr. Forrester now.
Thank you so much, Dr. Palmer, and thanks to all of you for participating on today's webinar. As Chris mentioned, the focus for today is to talk about how the COVID-19 pandemic has really impacted the mental health and well-being of all of us in the healthcare field, from frontline workers to office staff, in the emergency rooms, in the outpatient clinics. We've all been deeply affected in many ways that have affected us emotionally. And so today is really a brief presentation, first by me, and then a discussion with Chris and all of you about ways to take care of our own mental health and well-being, and what are some of the signs that we should look out for in terms of trauma, anxiety, and depression in the context of the pandemic. And as Chris mentioned, I'm a geriatric psychiatrist. So one of the areas that's been deeply affected by this pandemic, not just in the United States, but around the world, has been the disproportionate impact, not only on ethnic minorities, but also on the elderly. And so I do have one slide that addresses some of the issues that are specific to those individuals working in long-term care facilities. There we go. So first I want to present to you a few comments about key features of this pandemic that affect us all in healthcare. And some of these points really we've gotten used to a bit, but were really, I think, on the forefront of our minds and our experiences early on in the pandemic this past spring. So one of the things that arose in our hospital and in long-term care facilities where I care for patients has been the issue of no visitor policy. And that's really tremendously impacted our ability for our patients to communicate with their loved ones, especially in times of crisis. And in general medical settings and also in psychiatric settings, this has been pretty profound, where loved ones cannot see their loved ones can't see family members who are in the hospital. And in nursing homes and in assisted living facilities in the United States, essentially, now going on 5+ months, they haven't seen their loved ones in person. And in some cases, there's been opportunities for enabling telehealth visits, but it's been really challenging. The other issue is our need to wear personal protective equipment so that we can reduce our own risk of infection. And this has been specifically challenging with patient populations that have difficulty with communication or understanding, such as those with cognitive impairment or other neurodegenerative disorders. And I've been thinking about this a lot with my colleagues in psychiatry about the fact that we're able to interact with one another over telehealth and conduct outpatient visits. But when we're in the hospital seeing someone, we're all behind a mask. And in psychiatry, we look for facial expression and emotion to help us understand how someone's doing. And that's no longer as possible. The other really important issue is the issue of fear that arises out of a constant threat of infection. And the true reality that every time we walk into a healthcare facility, especially early on in the pandemic, where we had no idea who was positive and negative for the illness, where we were risking our own lives and also putting our loved ones at risk by coming home at night or coming home the next morning after a shift. So these realities, although we've gotten used to the reality that this is an ongoing threat and is no longer felt as acutely, perhaps, it's still there. And it will likely be there for some time to come. And then finally, there's been a massive impact on all of us in terms of social isolation. Although we may be interacting with people via video technology more than we ever could have imagined in our lifetime, or by the phone, we're not seeing people in person as much. And so this impacts our ability to maintain those social connections, which are so vital for mental health and well-being. I've seen this in particular with the older adult population that are isolated in their homes, normally so, but even more so now in the pandemic with less access even to seeing families. And this social isolation increases the risk of our own mental health and well-being and the risk for developing anxiety and depression. So it's important to remember, I just wanted to make these 4 points to put this pandemic in perspective and to think about how this pandemic is impacting our mental health and well-being. First of all, this is a historical crisis. None of us have been through this before, and it's exposing healthcare providers to stress that's not just going to go away after a week or 2 or 3, but it's going to be with us for months and possibly longer. And it will likely have long-lasting psychological and physical effects, especially if we don't recognize this stress or take action steps to try to mitigate the stress, which is a lot of what we're going to talk about today. Second, it's really important to normalize some of the symptoms and feelings that we're all experiencing. So for example, it's natural to feel anxious, afraid, or even irritable in these situations, and to experience transient changes in our mood and in our sleep as well. We may notice that we're becoming more testy with family members, more irritable with things that we used to be able to shrug off, or we're having trouble sleeping, or we're feeling physical symptoms of anxiety, like stomach ache and headaches and stress manifesting in those ways. Some of this is completely natural. I want to differentiate some of the normal symptoms from when you might want to worry and seek help in a little while. The third is you might also be wrestling with uncomfortable thoughts or feelings, such as the fear of being infected or infecting others, as I mentioned, or in some cases where healthcare providers are feeling resentment that they're being asked to step up in a time of crisis, while others are seemingly taking a step back and working remotely from home and doing jobs that can actually be quite helpful for patient care, but don't need to be done in a hospital or a direct frontline care setting. And then finally, it's very common that we may be experiencing feelings of guilt. Guilt that others are doing more than we are. Even if we're on the front lines taking care of very sick patients, but we're seeing our patients pass away or not do well and feeling like we should just be doing more. It's a natural feeling that a lot of us in the healthcare profession have exaggerated senses of guilt and superego, if you will, that we can do more perhaps than others, or we should be able to fix these problems. And I think that feeling of guilt, unfortunately, does contribute to some of the anxiety and depression that comes in its wake. And then finally, it's important to remember that having thoughts or feelings that are distressing don't make you a bad person. They're completely normal responses to a situation that is at once unfair, unfamiliar, and also overwhelming. As I mentioned before, I wanted to mention one thing about long-term care. So in the United States, and this varies around the world, but older adults in long-term care settings have been disproportionately impacted by mortality in the context of this illness. And in the United States, one of the first outbreaks was in the state of Washington, where in early March, there were the first deaths in a long-term care facility. And it's at least in the state of Massachusetts now, about 2/3 of all of the mortality is directly from individuals who had been living in assisted living or nursing home facilities. And there are many medical and other reasons for this, of course. But what I think is important to remember that although there's been a lot of talk in the press, at least we've seen this here in the United States, about the quality of care in long-term care, even the best long-term care facilities were not prepared to manage this pandemic. They didn't have the appropriate PPE. They didn't have the same medical infrastructure that was needed. And even the best facilities were hardest hit in terms of outbreaks and bad outcomes. The facility, for example, in Washington State that was first affected is one of the highest, was well above average in terms of their quality ratings on staffing and quality of care. And it can be very hard to feel like you and your team are doing a good job when your patients are suffering, there's great uncertainty. But it's also important to remember that doing all that you can while taking care of yourself is actually doing a good job. So I just wanted to make mention of that, because although it's this pandemic by no means is limited to these facilities, this has been highlighted in articles, commentaries, and research now over the past few months. So what happens to our brain when we're under extreme stress, and the extreme stress of caring for people in a healthcare setting, and then worrying about our families at home, whether it's our kids or our aging parents or our spouses, is really, really important to understand. So under extreme stress, we can become excessively impatient and reactive, and also even irrational in the things that we say and that we do. We also tend to look inwards, or we might have the tendency to look inwards and become self-focused or closed to the advice and suggestions of others. When we're stressed, we can start to feel, for example, that everything is urgent and everything is against us. And I can just tell you, reflecting on my own experiences early on in this pandemic, I felt like I was working all the time. I could never do enough to keep up. There were no such things as weekends anymore. The days blended into the evenings. There was less sleep involved, and everything seemed to me that it needed to be done with utmost urgency. And it's very hard to continue to function when things are in a crisis mode all the time. This puts extreme stress on our brain. The second is when we're calm, we're more able to actually think and problem solve, and to be more self-reflective, to sleep better, to eat better, and to relate and work better with colleagues, families, friends, and patients. When we're calm, we can actually be more introspective, reflect on situations and our responses, and we can also come up with effective and long-lasting solutions. When we try to make decisions too quickly when we're under stress, we often make decisions that are ill-advised in the long run. So the next few slides, for those of you who work with individuals with mental health issues, which may be everybody in the healthcare profession, it's important to recognize the difference between these normal feelings of being worried and stressed and not sleeping well, and when it may be more problematic and require further attention. So these are some of the symptoms of anxiety. And the key thing is when these symptoms are present and it affects your ability to enjoy life, to relate well to others, to do your job, to love your family. It's when these symptoms are escalated to the point where it's interfering with your quality of life and your functioning, where further attention and treatment is really needed. So some of these symptoms are excessive worrying, inability to shut down that excessive worry, psychic tension, psychological distress, feeling on edge, the inability to relax, startling easily. You hear a loud noise or somebody calls you or you get another email and all of a sudden your heart rate is up or you're starting to sweat. Becoming worried easily, feeling fearful, trouble concentrating. Too much anxiety does impair our ability to pay attention and to concentrate. I mean, we need enough stimulation and adrenaline, if you will, in order to focus and attend to our daily life, including our work. But when it's too much, attention and concentration goes out the window. Also, trouble sleeping, as we talked about before, is a symptom common to both anxiety and depression. And then in addition to inability to relax and feeling restless, there's also muscular tension. Many of us have been working long hours at computer terminals over the past 5 months. We've had our heads in certain positions. I imagine many of us are developing muscular tension in our upper extremities, on our shoulders, and our back, and our neck. But this can also be a sign not just of sitting at the computer too much, but also of anxiety. What often gets under-recognized is that part of what we're experiencing in healthcare is a traumatic experience. Some people go through traumas and they have no symptoms whatsoever. Whether their genetics are different, whether they've been through it before, whether they have some resiliency factors. Some people handle trauma in different ways. You can expose two individuals to the same trauma and they will handle it in a very different way. But there are some symptoms that indicate that trauma and the effects of trauma are present. And it's important to be aware of this in yourself. So are you withdrawing from others? Are you less interested in being with friends and loved ones? Are you not sleeping? Again, insomnia and lack of sleep really pervade all of these issues that we're talking about. We also talked under anxiety about hyperarousal, but also hyperresponsiveness, avoiding people, avoiding certain situations. There's also the experience, another symptom of trauma is re-experiencing the actual traumatic event. And when trauma is with us in a pervasive and chronic way, it's as if we're re-experiencing the trauma even when we're not working on a daily basis. And then in some cases where the trauma becomes more complex, as we call it in psychiatric terminology, psychosis may even occur. In other words, symptoms of trauma could include seeing things that aren't there, or hearing things that aren't there, or even experiencing flashbacks, for example. So psychosis or flashbacks can also be symptoms of trauma. And then finally, depression. We use the word depression a lot, but there are cardinal symptoms of depression that are well-known characteristics of this illness, and that they occur to a level of severity that it impairs daily functioning. So one is rumination, but it's not just worrying. It's actually ruminating on negative thoughts, on regrets, on losses, on what I didn't do well enough, or having a ridiculously high degree of expectation for oneself and ruminating on all of that. Depression affects our physical functioning in terms of appetite, sleep, and daily and daytime energy. So being tired all the time, interrupted sleep or too much sleep, as well as increased or reduced appetite can be symptoms of depression. We talked about trouble concentrating. This is in the context of trauma, anxiety, and depression. Feeling excessively guilty, worthless or burdensome, like you're a burden on other people. And then finally, a cardinal symptom of depression, which is present commonly, but doesn't often lead to a suicide attempt, are thoughts about dying or wishing one was dead or coming up with a plan of what one would do to harm oneself. These are common thoughts and worrisome thoughts of depression that clearly need medical and psychiatric attention. The good news is there's a lot that we all can do to try to monitor these emotional symptoms and to do something about it, to reduce their severity, or maybe even to prevent them from happening in the first place. And you may have heard a lot about this over the last 5 months, and you may be employing some of these strategies yourself. And frankly, many of you may have better ideas than this, but one is to actively monitor your stress and well-being. You could do this by naming and validating the emotions that you're feeling. Sometimes this works out best by confiding in a loved one or a friend. Sometimes it requires seeing a professional like a therapist or a psychiatrist to talk about this as a way to monitor. Other people use different techniques like journaling, writing, keeping a diary, using mental health apps as a way to document stress level and even plotting it out, for example, but actually proactively taking the time to monitor your stress and well-being. The second, and these are so obvious, but so hard to implement, exercise and eating. You need to exercise every single day. And it doesn't have to be for 2 hours. It could be for 10 minutes. It could be yoga. It could be cycling. It could be running. It could be walking. But some form of daily exercise that involves stretching, strengthening, or aerobics, either or, is really important. This will reduce your stress level. It will improve anxiety. It will improve your outlook on life. If you do it on a daily basis, you will sleep better. The data supporting the effects of exercise on mental health and well-being are remarkable. And by the way, in case you're interested, exercise may be the single most effective way at preventing the onset of cognitive decline with advancing age. Eating well is also tremendously important. So when we're working long hours, when we're feeling stressed, we look for comfort food that are often high in fat content. We look for carbohydrates and other foods that have high content of sugar. And poor eating habits will likely make all of these mood and anxiety symptoms worse. So healthy eating, I always encourage my aging adult patients and friends and family, for that matter, to look at diets that are focused on foods that you would find in the Mediterranean diet, if you will, and foods that are rich in antioxidants and certain vitamins and low in red meat, low in saturated fats, low in carbohydrates. Another really critical and obvious, but really critical point that's easy to forget and not pay attention to and not make time for during times of stress is staying connected to friends, family, and colleagues. I had a conversation this morning at work with my entire division over a telehealth video, and I said to them that over the last 5 months, we've been connecting with each other mostly virtually, email and video. And although it's been good and we're communicating and people are on board with what's going on, there's something that's missing. And I do think we have to go out of our way to think about safe and creative ways to stay connected with loved ones. Most of this will be remote. Most of this will be through telehealth, televideo, phone, etc. But if there are ways to see people outdoors with masks on, using social distancing, critically important. And I've been thinking in the workplace, how can we try to bring some sense of normalcy to this new time and way of being so that we continue to feel connected to one another? I think that's really critical. It's important to stay up to date with the information that you need. We need to stay up to date on new issues related to treatment for COVID-19 if we're on the front lines, or how to manage complications from the illness. But it's also important to take breaks from the media in particular. I remember in the first days and weeks, and especially month or two of the pandemic, I could not get enough of the New York Times and the Boston Globe and things on TV and social media, trying to figure out what was going on, thinking that magically if I was going to miss something, that I would totally miss something, and I wouldn't be able to help my patients or my loved ones or my colleagues at work. So I think I had a disproportionate sense of needing to stay on top of things, really to my detriment. Staying up to date with information is important, but you got to take breaks. Watch relationships and make sure or be mindful of unhealthy coping mechanisms that may start to creep in. So for example, your relationship with alcohol, with cigarette smoking, with drugs or other maladaptive behaviors. Your relationships with unhealthy behaviors, really important to be mindful of. We've seen lots of reports in the media about excessive use of alcohol and other drugs during this time. A lot of that is true. Some of it's being used as a coping mechanism. Maybe we can talk about this more in the question and the answers. It's important to pace your work. I've been thinking about this a lot, but our natural daily rhythms are completely disrupted right now. We're used to going to work, coming home from work. And during our commuting times, we often will have time to think, to relax, to listen to music, to talk on the phone, whatever it may be. And now all of a sudden, especially if we're working from home, we're often going from bedroom to work, to kitchen, to work. There's no natural break at all. You have to think about ways of taking breaks and build them into your day. And if you're going to the physical hospital or the other healthcare environment that you're working in, Think about ways to take breaks and not working all the time. The idea of a vacation, what is that anymore? What could that look like? How could you feel like you're taking time away? And especially if you have older parents you're caring for or young ones at home where they need you a lot, this is exhausting. So finding ways to take breaks is harder, but critical. It's also important to plan for your work. Again, the work-life balance is incredibly important still. And then finally, remember the connection that you have to the meaning and the purpose in what you're doing, honoring the service that you're performing, giving yourself credit for the work that you're doing, the hard work that you're doing, whether it's in the hospital, in an outpatient clinic, at home, completely remote, the work that you're doing is vitally important. There are many mental health resources that are available online, and I just wanted to point to two of them locally here in Boston at McLean Hospital and Mass General Hospital, two of the Harvard-affiliated hospitals in the Mass General Brigham system. But we have a series of webinars and tips related to helping yourself, dealing with specific family situations that are arising, like young kids at home, kids going off to college, supporting aging parents, things like that. And also recommendations for self-help apps, relaxation, and things like that on the mental health website for McLean. And then similarly, Mass General's compiled an amazing series of mental health resources that are available completely for free for the public, for families and children, for healthcare providers, dealing with our own mental health and well-being. And also opportunities for reaching out for actual care and getting connected to treatment, and when one might want to think about treatment versus some of the self-help tools. So really want to thank you for your attention, for listening to this. Hopefully some of that was helpful, and look forward to discussing it further with Dr. Palmer now in our discussion time.
So thank you, Dr. Forrester. That was a great presentation, a lot of information kind of packed in, and a lot of really helpful kind of starting points. So I want to remind people, if you do have questions for either of us, and even if it feels like it's not necessarily related to the presentation itself, but if it relates to mental health, we're two psychiatrists happy to lend our opinions, our advice, our expertise in any ways that might be helpful. So feel free to type in your questions and we'll get through as many of them as we can. We've got several queued up already. The first one really is more about understanding some people who, you know, I think a lot of us would say they are quote unquote behaving badly. So the people who refuse to wear masks, the people who are coming up with conspiracy theories about all of this, that it's not a real virus, that it's not really happening. How can we understand that? And is that a coping mechanism, or is that what is that?
I will give my own opinion, but this is one person's opinion, and I do think there's a lot of room for lots of opinion on this topic. But I think of it in two ways. I think some of it is, I think we've gotten to a point in the pandemic, probably around the world, but certainly here in the United States, where people reached a breaking point, where they felt like the social isolation was too extreme, where they were worried about the economic impact of the pandemic, and that there needs to be some type of balance. And I think, unfortunately, in order to maintain safety and to flatten the curve, if you will, in the early days, we had to take extreme public health measures to do that. And that had devastating effects both on the economy, but also on our own mental health and well-being. And I think people got to the point where they realized that we probably don't have to be as extreme in some of these measures, especially when the virus load, if you will, in the community is lower, and that we can probably be out more, interacting more, and frankly, going back to work more. Some people, however, have taken it to an extreme. And so that could reflect one of two things. One is minimizing what's really going on from a mental health coping standpoint. Maybe they are unconsciously very worried, and this is sort of like a counter reaction to that, if you will. But unfortunately, what I do worry about, and I'm curious for our friends and colleagues from around the world, it may be different, but in the United States, it's become a political issue. And I think that's awful, to make a public health crisis into a political issue. And I do think there's some segment of the people who refuse to wear masks And to think that what we're dealing with is a real pandemic is that in some ways, I think it's been unfortunately wrapped up in politics. And the virus doesn't understand politics. They don't understand borders. They don't understand geopolitical realities. But I think unfortunately the political aspect of this is playing into it as well.
Yeah, no, I think that's great. The next question: Are there things that employers can do to help their staff and to help reduce the negative psychological impact, the stress of all of this?
Yes.
What kinds of things can they do?
So I think I've thought about this a lot over the last few months in terms of employers and leaders within healthcare systems or even in the general other non-healthcare industries. It is so critical that leaders communicate with their employees on a regular basis, on a timely basis with factual information. Number one, that is so critical. That helps employees feel like they're part of something, that they're in the know, that they're not missing out. That will reduce stress and anxiety. They'll know that there's a plan. They'll know there's a leader. That is so important. It seems so obvious, but it is really important. And then part of that communication, I think also, is to recognize the stress and the anxiety and possibly depression and trauma that people are going through. And there are ways that employers can help their employees. There can be town hall discussions led by trained professionals that can be smaller groups even that they could be running for mental health, for health professionals to talk about the stress and the anxiety of what they're going through at work. Or it could be more educational topics like this, for example, or even opportunities to provide resources in your local communities to link them with mental health resources that are available. One thing that we found is that we offered a lot of groups for free for our employees. And interestingly enough, not a lot of people wanted to take advantage of them. And I think the reason for that was that, number one, people were just so busy. They had been on Zoom or they were sick of interacting with these sort of technologies all day long. And also they did not feel like talking about their feelings in front of other colleagues. And I think whether it was because of shame, embarrassment, guilt, whatever it may have been, there was a reluctance to talk about it openly. So I think providing avenues for one-on-one discussion with employees through human resources or through actual EAP programs, employee assistance programs with trained mental health professionals, I think is really critical for employers to pay attention to.
Great. Yeah. I think that's spot on. I want to add a couple of observations. So one, you made the point that, we had offered a lot of groups and not many people took advantage of them. And I think that gets into this topic of the stigma of mental illness or the stigma of not coping well. And in particular, in this economic environment. So I think people are terrified of losing their jobs, even in the healthcare industry. And even in the healthcare industry, people are being laid off or let go permanently because elective procedures went on a hiatus for months and they're still not up to speed. Everything is slowed down, putting on all the PPE, all of the added expenses. And so in this environment, I think employees are terrified to come out and say, oh my God, I'm overwhelmed and I don't know how much more of this I can take. I need a break. Because they look around at all their coworkers who are being tough and toughing it out and they're not complaining. And so it's like, if anybody's going to get let go, who's going to get let go? It's probably the person who's complaining and asking for help and saying, I don't know if I can take this. I don't know if I can do this job under these circumstances. And I think that is a real challenge for which there is not an easy answer. I know everybody wants, well, what do we do about that? Yeah, good luck. But I think the first step of doing anything about it is acknowledging that. And then I think in work environments along those lines, I do think that we could try to foster more of a teamwork approach and let employees know that we get that at least half of you are probably feeling stressed and overwhelmed. And so if you don't see any coworkers around you who are stressed and overwhelmed, you're blind right now. And we need you to open your eyes, and we need you to reach out to people and be more supportive. You know, if you see a colleague overwhelmed in a situation and you can do anything to help out, you can do anything to just, maybe, why don't you take a 5-minute break? That was really awful what you just went through. Please take a 5-minute break. You deserve it. That can go a long way in relieving people's guilt, relieving their fear that I'm going to be the one fired, and just knowing that you're being supported by coworkers and colleagues, and that everybody's kind of looking out for each other can be really helpful. It kind of reminds me of soldiers in a battlefield. Soldiers in a battlefield do that for each other. They all know our lives are threatened. This is not a pleasant experience. This is not good. Our lives are on the line. But they also know we've got each other's backs. We're here to help each other. If you get shot, if you're making a bad move, I'm there, and we're all coming out alive if at all possible. And they're kind of in it together, and they have that mindset. But part of that mindset has to be this acceptance that we are in an overwhelmingly stressful situation, and we expect some people to kind of be melting down. We expect some people to be overwhelmed, and that's okay. We're going to deal with it. We're gonna get everybody through it.
Chris, I was just those are great points. I just wanted to. You made me think of something that I just wanted to mention, and we'll get on to more questions, but. During when we go through the surges of the pandemic, like at least in the Northeast of the United States, we were in the surge in March and April and early May. And during that time of everyone is focused on what we need to do to stay safe, keeping our patients alive, working in an unusual environment where everything's changing from moment to moment to day, that really did feel like we were in battle. And in some ways, there were psychological effects that were happening in the moment that were hidden by the rush of adrenaline and the focus on what we had to do. And now there are two issues happening that I think are coming together to actually exacerbate the psychological toll. One is the downstream effect of what we went through a couple months earlier is now starting to rear its ugly head in terms of maladaptive behaviors, escalating feelings of anxiety, depression, and these trauma-related symptoms. But there's also this psychological issue where we've kind of figured out a way of, with viral levels going down, but still having to be on guard. It's sort of a new normal that's been created, which I think in some days you forget there's a pandemic, and yet everything is harder. Everything we do is harder. And our ability to interact in the hospital with each other, with our patients, with their families, is just so much harder than it ever used to be. And so we're not getting the attention we did in the beginning, like the healthcare heroes and all the rah-rah and the teamwork and the in it together and the Army acute battle mentality and all that adrenaline. And now it's just so like, this is now our life. This is what we're living with. And I think in some ways we have the after effects of the psychological toll from the acute trauma, but now we've got the chronic effects of the ongoing lower levels of daily stress and just how much harder everyday life is, that I think is contributing to, in some ways, a double whammy of distress now.
Yeah. And I just want to make the point that I think you're talking about Massachusetts in particular.
That's just here. Yeah.
And, but as I think about some other states or countries, Florida, Texas, they are going through the acute trauma now. Their ICUs are overwhelmed. Their healthcare workers are completely exhausted, overwhelmed, desperately trying to save lives, really on the front line of a war zone. And they are putting their lives on the line because they might get it. They're taking care of people who are dying of COVID. And so they certainly are at high risk of getting it themselves. And maybe giving it to family members or friends or anybody else that they want to interact with. And unfortunately, the predictions are that winter is coming, and that means everybody's inside again, and we're all in closed, circulating, uh, heat systems, and so is that gonna propel the virus even more? Are we gonna see another surge in the Northeast, at least, the northern states at least? And hopefully not, but given the way things are going, it seems like, if it can go wrong, it seems to be going wrong this year. That's kind of...
Just listening to you talk, Chris, I mean, I think some people may react to what may or may not be coming down the road with excessive worry and rumination and, oh my gosh, what am I going to do? And another person may say, I can't control that. So I'm not going to focus on that now. I'm just going to focus on getting through today. And I think it's really, I've been amazed at how I've never really observed this as clearly as I have recently, which is everyone responds to situations and risk differently. Risk tolerance between individuals is hugely variable, and it's based on a lot of different factors. So it's worthwhile being aware of your own risk tolerance as well as the risk tolerance of those around you, both at work and at home, because what you may see as being fine and safe, another person may be horribly anxious about. And I think it's just important to recognize that. And I think that sort of difference in risk tolerance is manifesting. There's no right or wrong way to deal with this. It just is what it is. And I think it's important to be aware of, especially employers, because one size does not fit all in terms of what employees need. This is happening right now in the United States. It's playing out in a large debate about whether to send kids back to school or not in the fall. And I think the reason why there's no clear answer is because everyone has a different opinion based on their own risk tolerance of what should happen.
Okay. I think, two people have asked a very similar question that it's a good segue. It's very much related to what we've just been talking about. But it's around this feeling of guilt of not doing enough. So one person asks, as physicians, how do we get around the feeling of not doing enough for our patients, when in reality, there's only so much we can do? But another person asks it about a slightly different topic. How do we stop blaming ourselves for not being productive enough? I see my friends being active, joining online competitions. Like Dr. Forrester is a big exerciser, as am I. And so he's one of these people that's probably online doing some competition, posting to Facebook. He's so great. And people are wondering, how do I keep up with that? Why can't I be that productive? What am I supposed to do? And how can people address these feelings of guilt or inadequacy? Because I think the big point that before I turn it over to you, the big point, I just want to reiterate what you just said a little bit ago. Everything is harder. And putting on a mask, being protective, being restricted in what we are not allowed to do, everything takes more time. And so I think this is ubiquitous. I think everybody feels like I'm not getting nearly as much done as I should be getting done based on the amount of effort I'm putting into this.
Yeah, no, these are great questions. So the two parts of this that I want to maybe address, one is the guilt around are not being productive enough as healthcare professionals. And the second is the guilt around not doing enough to do the things to take care of ourselves that we know we need to. So on the first level, I will tell you that in the beginning of the surge here in Boston, what was hard for me is that my clinical work in my career for quarter century has been in older adults. And I backed off from frontline inpatient work many years ago to doing outpatient work to now doing a ton of research and administrative work. And so my direct clinical interaction is so much less than it used to be. But my professional identity has always been as a physician educator first and a researcher administrator second and third. But during the pandemic, I felt such a pull and frankly a guilt about not being in the hospital every day with my colleagues on our inpatient unit, where we suffered an awful outbreak of COVID-19 that decimated about half of our staff and a lot of patients. And although I was with them via telehealth and I would come in periodically, I wasn't there on the front lines and I felt awful. And then I realized in talking to a lot of people that what I was doing as division chief and trying to be a leader was critically important. But I really felt like that direct patient care is really what I needed to be doing. And I don't know where that comes from for me, 100%. And I know for all of it, we have our own sources of why we have this exaggerated sense of guilt in terms of being healthcare professionals. I think the first thing to do is just be aware of it and not let it eat at you, and to talk about it and to just share your feelings and your stories with other people. That is, I think, just so important. The second part of it, Chris, you were alluding to this stuff about, comparing yourself to other people and productivity. Social media is problematic in this way. And you got to be careful. When you see somebody posting something online about all the stuff that they're doing, you have no idea what the reality is. You really have no idea. It may look good, but how many people are truly honest on social media about how their life is right now? It's not really what you see is not what you get. So try not to use that as a benchmark of comparing yourself to other people. That's a dangerous slope to go down it's hard to resist, but it is dangerous. And I think if you could just take a step back and not worry about what others are doing and worry about what you're doing, set your own personal goals, whatever they may be. What you're eating, what you're exercising, how much you're sleeping, how much time away from work you're taking. Set your own goals like you would when there's no pandemic and stick to them. And I think that's probably the best thing you can do. Do not compare yourself to other people. There's nothing good that comes out of that.
Yeah, no, I completely agree. In a way, I want to just augment that a little bit, because I think you're absolutely right. No two people are the same. And so if you're seeing a friend joining an online competition on social media and you're feeling like, oh, I should be doing that too. I think not comparing yourself to other people, trying to get over the guilt is important. But I think the pragmatic, concrete, like, well, how do I do that? How do I get over that guilt? How do I stop? I think that's like the $1 million question. So I'm going to attempt with a couple more maybe tips or thoughts that might be helpful, but it's really the $1 million question. Like, the world would be a happier place if somebody had the magical answer to that for every human being on the planet. But in my mind, I do think that one of the biggest things is it's about acceptance and self-compassion. And acceptance is acceptance of who you are and the life that you've got and the responsibilities that you've got. And so if you're a parent to young kids, if you're helping out your elderly parents, if you don't have nearly as much money as your friends who are online going around doing all these races or whatever and have nice bicycles and they're cycling everywhere, or taking nice vacations or doing whatever, everybody is different. And we all have different resources. We all have different strengths, but we're also different in the lives that we have led, the genes that we were born with, the upbringing that we had with all its strengths and all its shortcomings. And everybody's different. And if you've had a lot of adversity in your life, and then you're stressed on top of it, guess what? That you more than others are going to be pushed toward depression, toward post-traumatic stress disorder, toward anxiety, toward insomnia, through no fault of your own, simply because you had a rough life and somebody else didn't. And it can be easy to compare yourself and see what a loser I am, that they're doing everything and I should have enough time, or I should have the motivation, or I should have the energy to do that, but I just don't. I come home, I'm exhausted, I want to hide. I want to curl up in a ball on the couch and watch Netflix and eat and then go to bed. And I can't even pull it together to take a walk. I can't pull it together to do anything. And I think for those people, you need to practice some self-compassion, to just try to understand, how is it that I got to this place? Don't become hopeless and think you're trapped in that place, because you don't have to be. As a psychiatrist, I'm the first to say, there's hope for you. You can get out of that. But until you do get out of that, until you do the work and go through the process to get out of that, like, be compassionate, be nice to yourself. And because beating yourself up with guilt, with feelings of inferiority is only going to make your depression and PTSD and anxiety worse. And then you're just really stuck in a vicious cycle that you're never going to get out of.
Yeah, I agree.
Great. The next, another person says, can one develop an anxiety disorder from worrying about contamination, trying to keep safe, excessive hand washing? Can that lead to even OCD or anxiety? And what can we do about that if it does?
So anxiety, there are many anxiety disorders, but anxiety disorders are partly genetic and biological. We inherit the predisposition for developing them based on our genes and our family history risk. And they're also often triggered by external events. So there's often a biological, environmental interaction and psychological interaction that sort of leads to the manifestation of anxiety disorders. And it's important to remember that what was just described in this question were symptoms. Excessive hand washing or rumination or worrying or feeling muscle tension. Those symptoms might be mild, minor, and infrequent, or they could be all the time and impairing. And the key thing between anxiety symptoms and anxiety disorder is the degree of functional impairment that the symptoms create. So when the washing of the hands leads to 6 hours a day of washing the hands and bloody knuckles and infections in your skin, that's a problem. But if you're doing it to stay clean and disinfect, and it's not interfering with daily functioning, I wouldn't worry that that's going to lead to a disorder by itself. But I do think it's important to be aware of when those symptoms escalate in the intensity and the severity, the amount of time you think about it, and the amount of time you spend doing it. That's when that tips over into being a more of a clinical condition that really requires treatment as opposed to just self-care. All of this, whether there's a pandemic or not, we all need to practice self-care. We all need to do self-help through exercise, diet, nutrition, social engagement, other ways, whether it's yoga, deep breathing exercises, meditation, you name it. These are all self-help strategies to improve symptoms in daily life. But when it becomes a disorder and impairs functioning, usually all that I just said is still helpful, but it's probably not enough. And that's where you may need psychotherapy and maybe in some cases medication to be helpful. So I wouldn't worry that washing your hands a lot or being in an anxious situation and worrying a lot is going to create a disorder, but it does set up the risk for that in the person who inherited the genes and is now in an environmental situation, and when the person is not using these coping and adaptive strategies to try to reduce the symptoms. That's the way I would look at it.
Great. So we've got another question, and this one is specific to parents. So this person comments that it seems that the more information parents get, the more they worry and panic. And this person makes the observation that they feel like maybe people are becoming even overprotective right now. Any tips or strategies on parents, but I think this can kind of extrapolate to if you have elderly parents, if you have people in high risk groups, if your spouse is overweight and diabetic and had cancer 6 years ago, so they're recovered from the cancer, but they're a cancer survivor. These people in high risk groups, how do you think about the right balance in the same way that you just said? People can have symptoms. Sometimes those symptoms are normal and sometimes those symptoms are problematic. How do we think about those symptoms as it relates to worrying about other people, worrying about the germs, worrying about contamination, worrying about protecting people, that someone's going to get sick and die on us?
So I think, Chris, this comes back to the issues we talked about before, which is, well, there are two issues here in my mind. Number one, that we didn't talk about, and really, as a psychiatrist, I don't feel fully expert to really say much about this, is that the actual medical information, the scientific data, the reality of what's going on in the pandemic, the ways to protect oneself, the ways to actually do things like opening schools safely, this information is known and it's not being communicated clearly enough. I mean, it's not like we know everything about this virus. It's new to humankind, but we know a lot more than we did in February and January and in March. So there are ways to do things safer than other ways. The problem is we're not giving consistent messages in the public domain so that people, and we don't have expertise in every single school system or in every town or with every mayor. Doesn't have access always to the latest information. So I think having the right medical information so that we have some sense of what is the reality about safety and how to keep ourselves safe. So that, I'm not going to comment more on that, but that to me is a huge part of this. Okay. Even if everyone's getting the consistent message about safety and what we would need to do, we will still have people who on the one end will go out without a mask and be fine, not because they're politically motivated, but just because their risk tolerance is very, very high risk tolerance. And other people will never leave their house until there's a vaccine, will never go to the grocery store, will never see another person until there's a vaccine. And you see all of those ends of the spectrum. In one of our research studies that we're doing for individuals with Alzheimer's disease, we're giving them injections of an antibody to slow down disease progression. We shut down our research lab for 3 months because of COVID restrictions. When we were given the permission to open up again with very, very, very safe parameters in place, we had some people who couldn't wait to come back in, missed our staff, wanted to get the infusion, knew that we were going to take the utmost precautions, and couldn't wait to come back. And others that said, under no circumstances am I coming back to that hospital until there's a vaccine. I'm not even going to the grocery store. So I think what we're seeing, and part of this question is partly it's the information that's in the public domain is somewhat all over the place and not consistent. But even if it were completely consistent and we knew exactly what to do, we would still see this range of how people behaved based on risk tolerance.
Yeah, no, I agree.
So for schools, for example, I got a text before this thing. Our school system decided that we were going to have, or is debating hybrid model, like a little remote, a little in person versus fully remote. And apparently there's a protest going on right now in the middle of the town, blocking traffic because everyone wants to be remote because the parents feel unsafe and the teachers feel unsafe.
Wow.
But that's an example of how this all plays out.
Yeah. No, and yeah, you're right. It gets into a lot of really dicey issues because there are certainly psychological impacts on children being at home alone with unstructured time, so it's a mess.
So there's a lot. I mean, I don't want to go off on a tangent around this, but the whole parenting issue and taking care of kids right now, trying to worry about keeping your own job, having kids. I mean, all of us have experienced, those of us who are on Zoom all day long, whether it's with patients or with colleagues, we see other members of the family jump on people's laps. We see the animals crawling over the laps or in the background. And all of a sudden our interactions with others we're learning more about their lives, but the experience of trying to parent and set the boundary between work and home is becoming increasingly blurred and challenging. And that is exhausting. I know it's exhausting.
Yes. Exhausting. And as a parent, I will say adds to even more guilt because my kid is on video games an awful lot and I should be doing more with him. But, oh, by the way, I've got a full-time job I'm supposed to be doing in my office and I can't be tending to him all day. And so what am I supposed to do? Just accept that he's going to be on video games and TV quite a bit, much more than he should be, or accept that I need to be a little less productive at work intermittently, take breaks, go out and do something with him, go out and get him started on another project, whatever. And so I think finding that balance is really challenging for all of us.
Chris, if I had to say one final thing, I know we're going to run out of time, but I think it's really important for all of us not to suffer in silence, to be introspective and to take a step back and to think about how we're thinking and feeling so that we can recognize some of these warning signs and get professional help if needed, but certainly don't keep it inside. Our tendency to kind of self-isolate or keep our thoughts to ourselves during times like this is only going to be counterproductive. So reaching out and talking about this, I think, is a great first step.
Yeah, no, I think that's a great point to end on. talking to people, supporting them, asking for help. I think those are all really key to surviving this horrible, stressful change in the world that we're experiencing. So we're going to have to wrap up. As a closing reminder, you can get continuing ed credits for participating in today's session. To do so, you have to click on the link in the description below this video window to complete the evaluation and get your credits. This information is also going to be distributed through a separate email to all of you, today's participants. And if you want, please feel free to distribute it to colleagues, friends, family that you think might benefit from this information. And please think about joining us next week for a webinar on vaccine development and novel therapeutics. And with that, I'm going to say goodbye. Thank you, Dr. Forster, for a great—
Thank you so much for having me.
Yeah, so thank you all.
Bye-bye.